Answer Key 2025 NORCET 8. Kangaroo mother care, KMC, is typically continued until the baby reaches which of the following weights? Answer, 2,500 grams. A client is prescribed diphenhydramine 25 mg. The available concentration is 50 mg per milliliter. How many ml should you administer? Answer, 0.5 milliliters. Which of the following best defines massive blood transfusion in the context of trauma? Answer, transfusion of 10 units of PRBCs within 24 hours. A 60-year-old man presents with a core body temperature of 30 degrees Celsius. What ECG finding is most commonly associated with hypothermia at this temperature? Answer, Osborn waves, J waves. Which is most commonly associated with uremic disease? Answer, flapping tremor, asterixis. When administering insulin injections, what is the recommended minimum distance between injection sites to avoid complications such as lipodystrophy? Answer, 2.5 centimeters. A hospitalized patient has a modified early warning score, MUSE, of 7. What is the most appropriate immediate action? Answer, initiate emergency response and escalate to the medical emergency team. In some situations, a venous blood gas, VBG, will provide adequate information. As compared to an arterial blood gas, ABG, the VBG results will, answer, show a different oxygenation level. A 37-week pregnant woman suddenly develops abdominal pain and vaginal bleeding. What is the most likely diagnosis? Answer, abruptio placentae. A 65-year-old patient with chronic obstructive pulmonary disease, COPD, presents with shortness of breath. Pulse oximetry reveals an oxygen saturation, SPO, of 78% on room air. What is the most appropriate immediate action? Answer, initiate controlled oxygen therapy. While preparing a patient for electroconvulsive therapy, ECT, which of the following is the primary thing the nurse should ensure? Answer, ensure the patient is NPO. What is the primary mechanism by which Depo-Provera, medroxyprogesterone acetate, affect? Answer, suppression of gonadotropin-releasing hormone, GnRH. Which of the following is the most abundant gas in the Earth's atmosphere? Answer, nitrogen. A patient with serum sodium, Na, 150 MEq, L and potassium, K, 3.0 MEq, L requires IV fluid therapy. What fluid to be administered? Answer, 0.45% normal saline with KCl. A child who does not show interest in play is likely receiving which type of therapy? Answer. Image shown is Love's A maneuver. Image shown is gastrectomy feeding tube. Image shown is side effect of INJ, thalidomide. Image shown is hook technique. Image shown is cardiomegaly. Image shown is Valamento's insertion placenta. Image shown is Bandl's ring. Answer, third and fourth tracheal rings. Parts of Ambu bag. What is the recommended position for a patient after a craniotomy to reduce intracranial pressure? Answer, 30 degrees bed elevation. Which of the following formulas is best for fluid replacement in burn patients during the first 24 hours? Answer, Parkland formula. A 70 kg patient suffers 40% burns. According to the Parkland formula, what will be the expected fluid flow during the first 8 hours? Answer: 5,600 milliliters. Which of the following is not commonly used during endotracheal intubation? Answer: diazepam. Answer: Pap smear kit. Which of the following triad of death? Answer: hypothermia, acidosis, and coagulopathy. What are the most common complications of measles? Answer: otitis media. A patient scores 20 on the MMSE. What does this score indicate? Answer: mild cognitive impairment. A person repeatedly washes their hands. Drug of choice for treating. Answer: fluoxetine. Who discovered penicillin? Answer: Alexander Fleming. What is the best epidemiological method for studying the relationship between air pollution and respiratory disorders in a city over the last 10 years? Answer: cohort study. A pregnant woman with a hemoglobin level of 12 is recommended folic acid and iron under a scheme. Answer: iron 60 mg, folic acid 500 mg. What is the most common cause of complications in Guillain-Barré syndrome? Answer: respiratory failure. What is the total number of diseases covered under the National Immunization Schedule, NIS, in India? Answer: 12. Pre-filled injections are mostly used for which route of administration of medication? Answer: subcutaneous. Which of the following is an absolute contraindication for performing a lumbar puncture? Answer: increased intracranial pressure. Which of the following is an absolute contraindication for performing a lumbar puncture? Answer: increased intracranial pressure. Which of the following is the national aquatic animal of India? Answer: dolphin. Who is popularly known as the Missile Man of India? Answer: Dr. APJ Abdul Kalam. As per the Rights of Persons with Disabilities Act, 2016, a benchmark disability refers to, answer, 40% or more of a specified disability. Who was the first Indian man to land on the space? Answer: Rakesh Sharma. Which is most commonly associated with uremic disease? Answer: flapping tremor. Answer: central venous catheter. Thanks for watching Yellow Nurses. NORCET 8 exam paper. Like, share, subscribe for more nursing updates.